Following a hip replacement surgery, surgeons may order precautions for the individual to follow to maintain the integrity of the hip joint during the healing process. Let's review hip precautions as it may impact an individual's ability to get dressed. For a posterior or posterolateral approach, hip precautions include no crossing of the legs, no bending of the hip past 90 degrees, and keeping the toes pointing forward. Depending on the surgical approach your surgeon used, these precautions may be the same or different. For more information, or if you are unsure of your precautions, please check out the hip precautions video. It is important to maintain these precautions until you are cleared by your surgeon. Now, let's discuss putting on pants and undergarments after a hip replacement surgery. Oftentimes, individuals will twist or cross their legs in order to put on pants. Individuals may also attempt to bend at the waist past 90 degrees. Here are some examples of twisting and bending of the hip that should be avoided. Due to the new precautions, individuals are recommended to use adaptive equipment for dressing tasks. Let's see how to put on pants and undergarments with the use of adaptive equipment. It is recommended to dress the operated leg first. First, the individual should bunch up the pant leg until there is a clear hole between the waistline and end of the pant leg. Using the reacher, clasp the reacher claws around the bunched fabric. Place the end of the reacher with the bunched fabric by the operated leg and slide the leg into the hole. From there, the individual will use the reacher to bring the pants up until they are over the knee. Next, the individual will follow the same steps to dress the other leg. Once the pant hem is over both knees, have the patient stand using proper body mechanics and pull the waistline of the pants over the hips. Now, let's discuss how to put a sock on with new hip precautions in place. Oftentimes, individuals will try to twist and cross their legs in order to put on socks. Additionally, individuals may try to bend at the hip in order to put a sock on. Here are some examples of crossing and bending at the hip that should be avoided when putting on socks. Now, let's talk about how to put on socks with a hip replacement. The individual will utilize a reacher and sock aid for this task. Here is a quick view of the sock aid. The individual will slide their sock onto the sock aid on the side with no ropes attached. This will create an opening for the individual to slide their foot into. The individual will grab both ropes and drop the sock aid to the ground with the sock opening by the foot. The individual will use the ropes to slide the sock over the foot, choking up on the ropes as they are pulling the sock over. Once the sock is on the foot, the individual can use the reacher to readjust the sock as needed. To take off the sock, the individual can use the reacher to grab onto the outside of the sock and push down to pull the sock off of the foot. Finally, let's discuss how to put on shoes following a hip replacement. It is important to note that while the individual is putting on shoes, they should ensure that their hip is not bent forward past 90 degrees. To begin, the individual will place the shoe below their leg. The individual will slide the top half of their foot into the shoe. From there, the individual should place the long-handled shoehorn along the back of the shoe to help provide support for the heel when sliding into the shoe. Depending on the type of shoe you have, you may need assistance from a family member or friend to tie shoelaces or help slide the shoes onto the foot.